This is TRAXXfm. Playing your favorite music 24/7. Experience the excitement right here. Right here on TRAXXfm.
Well, hello and good morning and welcome to Momentum. My name is KG and today I'm being joined by my wonderful guest, Mr. Adam bin Mohd Alias, and he's already waving to the cameras, right? And he is a pharmacist with the Section 19 Health Clinic in Shah. Today we're talking about Ramadan fasting tips for gastritis patients, something very pertinent, especially in this wonderful month of Ramadan. Good morning and hello and welcome to the studio, Mr. Adam. How are you today?
Good morning, KG. I'm good. It's good to have to be here.
All right. It is lovely to have you here this morning as well. And of course, today we're talking about something that is very much a concern amongst our Malaysian friends and family, our Muslim friends and family who are fasting, because many of them do believe that gastritis can be exacerbated by fasting.
Right.
And of course, today you will be explaining to them exactly all about it. And let's get on with the questions, shall we? Now, of course, the very first thing, could you please explain what gastritis or gastric pain is?
Well, gastritis, or commonly known as gastric pain, is a disease that can often associated with abdominal pain. So if you have pain above the navel area, that most of the time is just a plain gastric pain. Generally, gastric pain is an inflammation or an irritation or an erosion of the stomach lining. It can occur acutely or gradually, depending on the situation. Now, the stomach itself has two mechanisms in place. One is the prostaglandin hormone-like chemical that is responsible for protecting the stomach, and the second one is the corrosive action of the gastric acid, and that one will break down the food that you chew and you swallow to smaller components to be able to be absorbed later on. And when there is an imbalance of these two, the protective factors or the aggressive factors that cause the inflammation of the stomach, hence result in occurrence of gastritis. So if you have imbalance, the more of the aggressor and the less of the protection, then you will get gastritis.
And of course, the protector is the hormone that you just mentioned.
Yeah, the hormone that will produce the mucous membrane. So it's a two-way thing where one produces the protection and one produces the aggressive factor.
I mean, our body is all about balance, isn't it?
It does.
Yeah. And actually, what are some of the more common causes of gastritis?
Well, there are multiple factors in causing gastritis. I think the most common one is stress.
Stress?
Yeah,
wow.
Stress can lead to gastritis. It can increase the acid production through one of the receptors, and it will... this will therefore, stress can increase the acid production, and therefore, it's when the increase of the
acid production, yes,
right, this will irritate more of the stomach when it's more than the protective factors.
Or if it's more than what the mucous membrane can actually handle.
Right.
Yeah, I mean, after all, stress is a precursor to our ancient times, right? Like when stress was when you're being hunted and all that, and your body needs to burn more, your metabolism needs to work harder, your body needs to burn your food faster so that you can get more energy faster, right? But of course, nowadays we get stress from work. So it's a bit tough. It's a bit tough.
Yeah.
And what are the signs and, common symptoms of gastritis? How does a patient know that they actually might be, going through gastritis?
Well, there are several signs and symptoms, and the most common is stomach discomfort, and it varies among individuals, and there are no symptoms, and sometimes people don't really experience the symptom itself. So, however, the most common ones is the abdominal pain or bloating, frequent burping or belching, or you can also have indigestion, nausea and vomiting, loss of appetite or weight loss, and the most serious one is the vomiting of blood.
Oh, wow.
That could be the most severe case of gastritis.
That would mean that the mucous membrane is literally not there anymore.
Yeah, it will be sorely lacking, and the acid is just attacking
eating away the stomach
and causing ulcers, and those will lead to the vomiting of blood and whatnot.
Wow, that is a bit on the scary side right now, like vomiting blood. That's something I've never actually heard before. And of course, as you said, bloating, belching, mostly all of this can be common signs and symptoms of gastritis. Now, of course, there is gastric pain can also be categorized into severe or mild. Right. So what is considered mild gastric pain, and what are some of the signs of the more severe gastric pains out there?
The mild ones is just the pain that you get frequently or not frequently, depending on the situation. And then it can be released with treatments and Antacids and whatnot. But the most severe ones is when you have a bleeding or black and tarry stools. That is the most common severe gastritis. So when you vomit blood or when you pass away stools, there is black in color. That is one of the severe ones lah.
Now, of course, we do get pains in our stomach and all that, right? Stomach pains, that's something usual. Now, would you maybe just explain to our listeners what would mild gastric pain actually feel like? How does it feel like?
It could feel like a short jabbing pain, just above the navel area, and it comes and go. It comes probably during lunch hour or dinner when you usually have your meal set.
Your body has been conditioned to believe that during that time is your lunchtime, average time, so production of acids
will be higher during that time.
Okay. Now, Mr. Adam, we're going to be taking a short break, right? We'll be taking a short break. We'll be listening to a song, and once we come back, we have more to talk about, especially during Ramadan. Many patients, they do believe that fasting can be a cause of gastritis, but we will be here to talk about that in just a few moments. But right now, let's get on with the music. This is Sun by 4 Pillars of Pain, right here on Track. Hey, welcome back to TRAXXfm's Momentum. You're currently listening to KG on Health on TRAXX with our guest, Mr. Adam bin Mohd, alias the Pharmacist with Section 19 Health Clinic, Shah. We're talking about Ramadan fasting tips for gastritis patients. Now, of course, we have talked about gastritis, what causes it, what are the signs and symptoms. Now, can I ask you, Mr. Adam, can heartburn or the such be a byproduct of gastritis?
Heartburn can be byproduct of gastritis because when you have too much of the gastric juices, it tends to sometimes overflow into your upper
tract,
and that will cause irritation to your esophagus and whatnot. That is most of the time is the cause of heartburn.
Most of the time. All right, lovely. Now, of course, let's talk about the main core of the topic today. Fasting during Ramadan. Now, many patients out there do believe that fasting can be the cause of frequent gastritis attacks during the month of Ramadan. Is this true?
Not really. Often gastritis is associated with a condition called cannot starve, meaning people think when you are fasting, then you cannot fast. If you have gastritis, then you cannot fast, causing the patient unable to eat. However, many people thought that empty stomach will cause acid level to rise in the body. However, the fact is, during fasting, the digestive system rests and decreases the gastric acid secretion, meaning it relaxes your stomachs and your digestive systems when you fast. Therefore, the pain or indigestion due to high gastric secretion is not true.
All right. So, from what I can understand is, if you start fasting, then your body reacts to that, and it reduces the amount of gastric juices that it's released.
It learns to relax a bit.
Okay. So, essentially, maybe for the first 1 or 2 days, the juices still might be at the same levels, but after that, it will go down.
Yeah. After a few days, you will learn to adapt to the...
It will regulate itself.
Yeah,
wonderful.
Regulate, yeah.
Yep. And will fasting actually lead to unwanted complications, such as you mentioned, increased acid levels in an empty stomach, thus aggravating gastritis?
Well, it depends. Fasting, it depends on the condition of the patient itself. If you have a severe gastritis, and those with ulcers, that might lead to aggravating the gastritis and whatnot. But those who are just having normal gastritis, on and off, not frequent, then fasting does not lead to aggravating any gastritis. It will, like I said earlier, it will relax the stomach, and then it will learn to decrease the acid juices at certain times.
And also allows you to become leaner and slimmer.
Hopefully.
Hopefully.
Are you fasting, KG?
Once in a while still. Yes, absolutely. When my wife forgets to give me food. Now, what are some of the things that you can actually do, not only during Ramadan, but all the time, to prevent gastritis? What are the things that you need to avoid?
Well, if you have a severe gastritis and you're prone to having the symptoms and disease, then before Ramadan, actually, you need to plan yourself and, go check it out with a physician and whatnot. But those who are,
just simple mild ones,
and then you can, what you can do is try to control on what you eat, especially during sahur and breaking the fast.
Oh, wow. Okay.
Right. So, especially like during fasting, you try to avoid foods in high acids, such as lemon or oranges.
Oh,
so
okay.
if you have gastritis before, try to
reduce those.
Reduce taking orange juice and lemon juice and whatnot.
So no citrus, basically.
That will reduce the acidity in the stomach.
Okay.
You try to avoid canned food because that has high acid content. You can also avoid spicy foods. So try to avoid curries, sambals. My wife prone to sambals and she
nasi lemak.
Nasi lemak. So try to avoid that, And then you try to avoid also fried and greasy, fatty foods, carbonated drinks, and caffeinated beverage. So when you break your fast, you try to avoid this kind of food at first. You eat light meals and then continue with the heavy food later.
So, if you don't mind me straying a bit, would a dietitian will also be, someone suitable for a patient with gastritis to visit before Ramadan?
Absolutely. I mean, the dietitian is the best person if you want to look into diets and what you can eat, what you cannot eat. So fasting doesn't mean, and fasting with gastritis doesn't mean that you cannot fast. You can fast, but you need to go on a certain diet, probably a special diet, so to prevent the aggravation of the gastritis itself.
So a dietitian, guys, a physician and a dietitian before you Ramadan.
And a pharmacist.
And a pharmacist, definitely. Because we have a pharmacist in the studio today.
A pharmacist.
We can't forget the pharmacist.
Please refer to your local pharmacist.
Absolutely. Now, of course, sometimes gastritis cannot be avoided. It's just the way that the body is conditioned. It's the way that their lifestyle has been for many years. They already have gastritis.
True.
So during that time frame, they would definitely need to see a pharmacist to get medicines. Now, what are some of the medicines that can be used or, that can be prescribed to actually help relieve symptoms of gastritis?
You can get over-the-counter medicines, and some of them to help to relieve symptoms. You can either get the tablet, the chew types, or the liquid one to drink. And most commonly, these are antacids. Antacids are generally a class of medicine that reduce abdominal pain or heartburn due to gastritis. The way antacid work is by neutralizing excess acids, thereby reducing the acidity level in the stomach. And antacids are, like I said earlier, it's available in tablet or liquid form. So you can either get the tablet ones or the liquid ones. So you need to, for the tablets, you need to crush or chew to increase the absorption rates. You don't need to swallow it. You need just to
bite it and suck on it.
So in addition, you can also have antihistamines such as ranitidine or cimetidine, and this may, but the most serious one are the proton pump inhibitors. But this one you need to get from a physician.
All right.
Not from over the counter.
Because that is a very specialized medicine.
Yeah, it needs to be prescribed.
Okay. So essentially, if someone with gastritis has to take medicines, right, when would they take it?
Depends on your attacks or incidence of gastritis.
Okay.
If you tend to get during sahur, then you can get you take it before sahur.
Before sahur.
Or during buka, you can take buka. So, and one of the trick also with dieting and to prevent gastritis is to take sahur as late as possible.
As late as possible.
Yeah, try not to take sahur at 2 or 1 in the morning and then go to sleep. That is not the best action.
Yeah.
Because then it will prolong the stomach emptiness. Yeah. And then during buka, also try to take as soon as possible. So not before the azan, after the azan.
Of course. Don't batal your puasa. That's what Mr. Adam's trying to get at. And as you said, and of course, sleeping after eating, especially, as you said, some people might eat at 2 and then they go to sleep and then you wake up because they know they won't be awake during sahur, right? So that's not a very good practice as well, mainly because eating after sleeping is not a good thing.
Not a good thing. Well, it leads to heartburn, like what you just asked just now. When the body, you're not supposed to lie down after
eating
a heavy meal or eating, because then it will make the food or the juices
travel upwards
into your esophagus, and that will irritate it and cause heartburn and whatnot.
Absolutely. Now that's an advice everyone can take, not only during Ramadan but every time of the year. Now you mentioned antacids. like, should they stick very closely to the dosage, or can they like increase the dosage based upon their severity?
Yeah, the Antacids is, you take if you as needed. Whether it's stronger pain or just a minor pain, and you just take 1 or 2 tablets. It depends on the instructions.
Yeah. All right. Lovely. There. Now, earlier you mentioned about ulcers and all that. Can stomach ulcer patients fast during Ramadan? And what are some of the tips that patients can actually practice, Doctor, Mr. Adam?
Well, if you have gastric ulcers, then most probably you'll be on medication and whatnot. Just check with the physician beforehand, before going on to a fast during Ramadan, because like I said earlier, if you have ulcers, then when you're fast, you might aggravate the gastritis and the ulcers more. And then, what are the tips that you can practice is that if you're on medication, continue taking your medication. And then if you have a prolonged ulcer with pain, then you check with the physician. It might be an infection that could be treated with antibiotics and whatnot, and for a short duration of time. But the best thing is to stick to your medication as per schedule.
As per schedule, yes, absolutely. I mean, like, even in the holy month of Ramadan, if you really need to, take care of yourself, then you really have to do it, right?
Right.
Absolutely. Now, before we end, we've got a couple more things to talk about. What is your final advice and take-home message?
My final advice and take-home message would be is having gastric problem is not an excuse to avoid fasting. Fasting is good for health. So patients should always consult with doctors and pharmacists for advice regarding the readiness and suitability of their health conditions. For fasting, nutrition and medication to be taken during fasting. And it is crucial to make the necessary adjustment of how you fast to ensure that you can do it healthily and safely. The keyword is healthily and safely. So according to religious and medical views, if the pain becomes unbearable, it is advisable to break the fast. It is permissible if a person is unable to fast due to medical religious reason, therefore should not force yourself to do so. So you can break fast if you have a very severe gastric pains.
Yes, absolutely. And I find that sometimes if you don't do it at that time because you are very pious, it might lead to even more severe symptoms down the road.
Yes.
Yeah. So better treat it at the butt.
Absolutely. And Islam, if you're in pain or if you're suffering, you can do what it needs to do lah. And lastly, any further inquiries regarding medication and whatnot, you can direct the call to the National Pharmacy Call Center, NPCC, at 1-800-886722. Again, 1-800-886722. Monday to Friday, 8 a.m. to 5 p.m. except for public holidays. So you can direct your calls if you have any queries on your medication at the National Pharmacy Call Center.
Yep. So there is a dedicated line right now.
Yep.
So do call. Ask them anything about any of the issues. Not only about fasting, not only about gastritis, but you would be able to talk to them just about any single problem that they might have.
Yeah, regarding medication.
Yeah. Not financial. Only medication.
Not financial, not relationship, just medication.
Definitely not relationship.
Absolutely.
Now, of course, talking about relationships.
Right.
All right. So this is something more personal to you, Mr. Adam.
Yeah.
Today is the birthday of a very special person.
Yeah.
So I would let you do the speaking right now. Now, what would you like to say to this special person, Mr. Adam?
I'm just going to wish happy birthday to my lovely wife, Mariam, who's listening right now. She's taking her day off for today. So hopefully, we're going to have a nice years ahead. So thank you for everything.
So this just got you a really good buka puasa for today, Ben.
I hope so.
All right, with that, this is a song that you requested for your wife. This is Dato' Sri Siti Nurhaliza Bukan Cinta Biasa. And with that, It's about time we end Health on Tracks. It's been absolutely lovely having you here, Mr. Adam, today.
Great to be here.